Good day, ma'am. I am Rachel May Morales, BSN 2 Section 8. For today's return demonstration, I'm going to perform catheterization of a female patient. So for our assessment, we're going to check doctor's order. Okay. And then, we're going to review patient's record and nurse's notes. Then we're going to find out whether a urine specimen is needed. Okay, so a urine specimen is needed. Then, we're going to determine whether the procedure is to be a straight or indwelling catheterization. Okay, so indwelling catheterization. So now we're going to assess status of patient. So first is the time of last urination, level of awareness or developmental stage, mobility and physical limitation, and patient's age. Good morning, ma'am. I am Rachel May Morales, ma'am, and I'll be your student nurse for today. May I check your wristband, ma'am? Pwede rin mo isulti mong ngalan, ma'am, of birthday?
Kaya 4 December 25, 1980.
Okay, ma'am. So, nalang ko'y gamayong pangutana, ma'am. Kano saan man kalas nanihi, ma'am?
Nagunta.
Mga unsa man ang orasahan, ma'am?
Alas 7.
Okay. So, asa man karon nga lugar, ma'am?
Hospital.
Very good. Unsa man rong adlaw, ma'am?
October 3.
Okay. Labay party sa imong lawas, ma'am? Ang nasakit karon?
Wala.
Okay. Pila may atong edad, ma'am?
40.
Okay, ma'am. Then, we're going to determine if patient has distended bladder. Kumusta man, ma'am, anang imong pagpamihi, ma'am? Sakit ba, ma'am?
Yes.
Okay, ma'am. Thank you. And then, we're going to assess patient's knowledge of the purpose of catheterization, and after that, we're going to explain procedures to the patient. So, karon ma'am, na ako diri ma'am para mag-perform of catheterization. So, nabakay idea ma'am kung saan ang catheterization?
Wala.
Okay, ma'am. So, ang catheterization ma'am is an insertion of the catheter to the urinary bladder through your hiatus. So, nako i-insert ma'am nga catheter ma'am sa imong perineum area ma'am para dito ka manghim ma'am. So, it is important ma'am to relieve discomfort caused by retention of urine and to empty bladder before an irrigation or installation of a drug ma'am. So, okay lang ba ma'am nga itong i-perform na ang procedure karon?
Yes.
Okay ma'am, so thank you very much ma'am. So now let's move to planning. So we're going to identify first the expected outcomes following the completion of procedure. So bladder distension is relieved, patient's verbalization of relief from discomfort in bladder within 24 hours of catheter insertion, minimum of 30 ml urine specimen is present in urinary collection bag every hour, patient verbalizes minimal pain during the procedure, and the patient verbalizes purpose of procedure. Next, we're going to select specific type and size of the catheter to be used. So our catheter have a size of 16 French. Now, we're going to wash our hands. And now we're going to prepare the equipment. So we're going to obtain catheterization pack. Then we're going to complete catheterization pack including the following using strict aseptic technique. So this includes the sterile catheter, the lubricant in goods, and the sterile syringe filled with sterile water. So we have here our equipment that includes the sterile and the non-sterile equipment. So in our sterile, this includes our bowl, the dry cotton balls, forceps, sponges, specimen bottle, catheterization sheet, the Foley or indwelling catheter, pair of sterile gloves, the cleansing solution, the lubricant, syringe, and urine collection bag. While in our non-sterile equipment, so we have here our waterproof pod as an alternative to Calipod, the bath blanket, lamp, adhesive tape, towel, washcloth, kidney basin, working forceps, the soap, disposal gloves. Then we have down here our basin filled with warm water and the bedpan with paper lining and covered with paper. So now we're going to bring and organize equipment on the bedside. And then we're going to do implementation. So we'll already identify our patient, which is Mrs. Jairo Pachon, a 40-year-old woman. Now we're going to prepare the unit and provide privacy. So now we're going to prepare the patient. So we're just going to lower the side frame. Okay. Then we're going to wear our gloves. And after that, we're going to position patient on a dorsal recombinant position. Walang may isa mga ha. Pwede natapik ko na itong mga ligay. Okay. Wala ko ibutang ha. Wala kong pad ha. Pwede rin mo isa yung sabot ha. Okay. So, gusto ba niyo manghihi usap, ma'am?
Oo.
Okay, ma'am. So, lang po usap. Pwede niyo mo isa yung ampot, ma'am? Okay. Nalakog mana na ka, ma'am, ha? Okay, ma'am. So, akong paula. Okay. Then, let's do diagonal drape. Okay, so mag-drape ka, ma'am. Din mo kapta ni ma'am. Okay, so diagonal drape.
Oh, malagi.
Oh, kanipod. Okay, thank you. Okay. And now we're going to position lump to eliminate perineal area. Okay, so we're just going to place it here. Okay. Then we're going to place kidney basin at a convenient area. So we're just going to place it with paper line here. Okay. And after that, we're going to wash perineal area with soap and water as needed. Then we're going to dry it. So now we're going to open catheterization pack, then we're going to place it between patient's legs. Okay. We're going to use our working forceps to open it. Okay. Then we're going to organize supplies on sterile field. So we're going to place 7 to 8 cotton balls. And also the gauze or sponges. Our sterile forceps. Our lubricant. Then we're going to place our urinary collection bag here. And we're going to open our catheter pack. Okay. And our gloves, so that we can change to sterile gloves. So here are our organized equipment. So we're going to change gloves to our dominant hand. We're going to change it to sterile gloves. Then we're going to fill our syringe with sterile water. Okay. Then we're going to remove the plastic of the catheter. Good. So now we're going to apply sterile drape. So we're going to keep gloves sterile. Then we're going to change the non-sterile glove hand to sterile gloves. So we're going to place the sterile drape. Then we're going to pick up the catheterization sheet, and then we're going to unfold it without touching the non-sterile object. Then we're going to place the catheter pack and contents on sterile drape between the legs. So here. Then we're going to open the specimen bottle. Here. So now we're going to cleanse the urethral meatus. So with non-dominant hand, we're going to carefully retract labia to fully expose the urethral meatus. Okay. Here. Then we're going to maintain positioning of non-dominant hand throughout the procedure. And with the use of forceps in sterile dominant hand, we're going to pick up cotton balls saturated with antiseptic solution. Then we're going to cleanse perineal area in direction. So we're going to wipe from front to back, from clitoris towards the anus. So we're going to use a new cotton ball for each area while keeping the labia separated. Then we're going to cleanse using the following sequence. So first is at the center of your urethral meatus. This part. Further labia minora. Nearer labia minora. Farther labia majora. Nearer labia majora. Then back to center of urethral meatus. So after that, we're going to move bulk containing catheter here. Close to the patient. Then we're going to pick up catheter with glove dominant hand, 7.5 to 10 centimeter from the catheter tip. Then we're going to place distal end of catheter in bowl. So here. So now we're going to insert catheter. So we're going to lubricate it. With alkali jelly. Then we're going to ask patient to bear down gently as if to void. Then we're going to slowly insert catheter into the urethral meatus. So we're going to use a sterile gloves in retracting it. Medyo utong lang gamay ng hat. Medyo sakit. So after that, we're going to release labia and hold catheter securely with non-dominant hand. So we're going to inflate balloon if retention catheter is used. So now we're going to collect urine specimen. Okay, so it is now connected to the urine specimen collector. Okay, so we're going to allow bladder to empty fully unless institution's policy restricts maximal volume of urine drained with each catheterization. So for about 800 to 1000 milliliter. Now we're going to inflate balloon fully per manufacturer's recommendations. Then we're going to release catheter with non-dominant hand and push gently to feel resistance. Okay, so we're going to clamp it. Going to get the urine specimen collector and cover it. I'm going to fill 5 ml of sterile water. Okay, so it is now secure. Then we're going to attach end of the catheter to collecting tube of drainage system. Then we're going to anchor catheter correctly. Okay. So we're going to remove this. Here. Okay. Okay, so it is now attached. Then we're going to place an adhesive tape. Okay. We're going to assist patient to a comfortable position. Then we're going to wash and dry perineal area as needed. Okay, so ito lang i-remove ma'am. Drape. Ito na isa gamay. Okay. Jadi isa gamay ang sampot mo. And then straight balik ma'am. So after that, we're going to dispose urine in proper receptacle or toilet bowl. Then we're going to flush after. So now we're going to do proper aftercare of equipment. So we're going to dispose contaminated supplies. For city cases, we're going to soak equipment for 30 minutes. And then SUMCFI, going to use 1 part chlorine solution into 9 parts water. We're going to wash with soap and water after. And for no city cases, we're going to wash with soap and water. Then we're going to return clean equipment to its proper places. So now we're going to remove our gloves and dispose properly. We're going to wash our hands. Kumusta man imong paminaw man paghuman nato catheter, ma'am?
Okay naman, medyo sakit gamay.
Okay, ma'am. So, thank you kay ma'am sa imong cooperation, ma'am.
Salamat po. Hindi na ko mag-isip kami kaya namin kagutin.
Okay, ma'am. So, thank you also, ma'am, and have a great day. For our evaluation, we palpate bladder, we ask about patient's comfort, we observe character amount of urine in drainage system, and we determine that there is no urine leaking from catheter or tubing connection. So now let's move to the recording and reporting. So first is the date and time of catheterization, so October 2, 1 p.m. The type and size of catheter inserted, so 16 French. And whether specimen was obtained and sent to laboratory, so we already sent the urine specimen to the laboratory. Next is the amount of urine drained, so 30 ml. Description of urine, so it is yellow. And the patient's response to the pain, which is the patient verbalizes a minimal pain during the procedure, and also the patient verbalizes the purpose of procedure. That will be all. Thank you.